inspect and palpate your mouth, nose, and throat. Okay, look at your nose, look at your mouth. Can you show me your teeth? Okay, cranial nerve number 9. The glossopharyngeal nerve is intact. The gums are pink. Can you see your teeth again? Teeth are intact. Tongue is midline. Can you stick your tongue out for me? Perfect. There's no plaque, missing teeth, edema, or lesions noted. The tonsils are present and the tongue is midline. No signs of ulcers or inflammation. I'm going to assess the cranial nerve number 2, the hypoglossal nerve. I'm going to inspect that by, can you stick your tongue out for me and say ah? Okay. Can you say light, tight, and dynamite?
Light, tight, and dynamite.
Perfect. I'm going to assess cranial nerve number 9 and 10. I'll be doing that by, you stick your tongue out for me. I'm going to check your gag reflex, okay? But first I'll let you just smile and clench your teeth. Alright. You stick your tongue out for me and say ah again. Alright, you stick this tongue on there and check your gag reflex there, okay? Perfect. This gag reflex is intact, okay? Now I'm gonna have you, can you please frown? Alright. That's cranial nerve number 7, the facial nerve. And close your eyes tightly. Close your eyes real tight. I'm going to try to open them, okay? Alright, facial nerve number 7 is intact. Can you lift your eyebrows? Perfect. And show me your teeth again. Now can you puff out your cheeks with air? Okay. Now I'm going to press and air should escape. Air does escape symmetrically in both sides. I'm going to assess cranial nerve number 5, the trigeminal nerve. We'll do that by, can you clench your teeth once again? Alright, I'm going to assess your temporal muscles. They are symmetrical on both sides. Perfect. Now, I'm going to test your sensation. Keep your eyes closed. And you tell me when you feel this, okay? Just say when.
No. Yeah. Yep.
Okay, trigeminal nerve number 5 is intact. Okay, I'm going to assess your olfactory cranial nerve. Can you close your eyes for me? Cover one nostril. And you tell me what you hear. You smell. Close your eyes.
Ginger.
Okay. And now cover your other nostril for me. And you tell me what this is.
Hot sauce.
Okay, perfect. Well, the olfactory nerve is intact. Going to assess now the cranial nerve number 11, the spinal accessory. I'm going to assess the trapeze and sternomastoid muscles. They are symmetrical on both sides. Alright. Sternomastoid, it is symmetrical on both sides. Can you turn your head against my hand? Perfect. Now the other side. Very good. His head is turning forcefully against the resistance. Now your shoulders. Can you please shrug your shoulders up? Whoa, too strong. Alright. The cranial nerve number 11 is intact. Now I'm going to assess your coordination and motor skills. I'm going to have you take your hands and pat your knees back and forth and increase with speed. Perfect. Now can you touch your finger to your thumb? Very good. Alright. And now touch your finger to your nose. And touch my finger. Very good. One more time. Touch your nose, my finger. Now the other hand. Very good. Now I'm going to take your heel. Run it up and down your shin. Very good. And the other leg. Coordination is intact. There is no ataxia.
Action.
Going to assess his balance and gait. You go ahead and walk for me, heel to toe. Perfect. You come back. Alright, his gait is smooth and effortless. Now you stand over here for me. We'll do the Romberg test. So you stand with your hands and feet to your side, like this. You close your eyes. And we observe for 20 seconds. you bend your knee, one knee, and hop in place, and open your eyes too. Perfect. Now switch. Very good. Now I'm going to assess the sensory function. I'm going to run this cotton ball along you and you tell me when you feel it, okay? Close your eyes. Alright. You just say now when you feel it.
No. 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 No.
Alright. Now I'm going to assess your spinal thalamic tract. That assesses pain. You just tell me when this is sharp or dull, if you feel whatever it is, sharp or dull, okay?
Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull.
Alright. The spinal thalamic tract is intact. Now I'm going to take the tuning fork and you tell me when you feel it starting and stopping, the vibration, okay? And this assesses the posterior column tract.
No. Stop.
Okay. I'm going to assess the other hand. You tell me when it starts and when it stops.
Stop. Stop.
Okay. Now I'm going to do this on your both big toes and you tell me when it starts and when it stops.
Did you get my eyes closed still?
Yes.
Stop. Stop.
Okay. You tell me when it starts and stops.
Stop. Stop.
Perfect. Alright. Now I'm going to assess positioning of your fingers. You tell me if it's whether I'm moving it up or down, okay?
Up. Down. Up. Down.
Okay, perfect. This hand over here.
Up. Down. Up. Down.
Okay, position is intact. Now I'm going to assess the sensory cortex bilaterally, beginning with sterogenosis, which is you identify what this object in your hand is, okay? What is that?
Hair clipper.
Perfect.
Yeah.
Now we'll do the other hand. You tell me what this is.
Bracelet.
Perfect. Alright. Now I'm going to do 2-point discrimination. It starts with 2 clips, and you tell me when they stop at 1 point. Okay?
Stop.
Alright. Now with extinction, you keep your eyes closed. I'm going to touch both sides of the body at the same point, and you tell me how many fingers you feel and where. How many fingers do you feel and where is it?
2 on my shoulders. 2 on my arm.
Okay.
2 on my knees.
Alright. Now I'm going to assess the sensory cortex with graphesthesia. I'm going to trace a number into your hand and you tell me what the number is.
1 million.
Can you do that again? That was not 1 million.
No, 14.
What was that?
3.
Okay.
3.
Perfect. Now with point location, I'm going to touch your skin and remove my finger and you tell me where I just touched you.
My chest. Stomach.
Okay.
Knee.
Alright, perfect. Alright, now I'm going to assess his reflexes bilaterally, beginning with the forearm. You do that by supporting your arm in my arm. Okay. Okay, now we'll go to the others. Bicep. Okay. And now we're going to do the brachioradialis reflex. You hold the thumb, and I'll hit your forearm. Alright. Over here. Perfect. And then the tricep. So reflex. Okay, just relax. Tricep reflex over here. Alright. Now the quadricep reflex. Put your hands on your knees. Alright. Just scoot back a little bit. Any more? Scoot back.
I mean, like, oh.
Yeah, like that. Okay. Okay. Alrighty. Now I'm going to assess the Achilles reflex. Keeping the foot out like this. Dorsiflex. And then hitting the Achilles reflex. Perfect. Let's see over here. Dorsiflex the foot. With the same foot here, I'm going to assess the plantar reflex by going out on the lateral side. Same over here. Now I'm going to assess clonus and just dorsiflex the foot here. Perfect. Clonus is intact. This side. Clonus is intact. Alright, now I'm going to assess your heart, lungs, and blood circulation, okay? Just take a look at your chest. Just breathe normal for me. It's symmetrical, no retractions, no flaring of the nostrils or labored breathing. No signs of pursed lip breathing as well. There's no bulges or deformations in the chest or lung area. Going to assess your nail beds. There's no cyanosis or clubbing present. Capillary refill is intact, less than 3 seconds. Okay, capillary refill is intact, less than 3 seconds. There's no clubbing or cyanosis noted. Alright, relax for me. The suprasternal notch is right here. Here's the sternum. The angle of Lewis is right about here. And then the interior chest is symmetrical there, and the costal angle is right about here. Alright. Okay, now I'm going to show you where C7 is right about here, and T1 is right here. And then also the posterior chest, which is symmetrical in movements on both sides. Alright, now I'm just going to assess anterior side of tactile fermentus. Now, you just say 99, okay? I'm going to assess for the symmetry of vibrations. 99.
99. 99. 99. 99. 99. 99. 99. 99.
Alright, vibrations were symmetrical. Now I'm going to assess anterior percussion with my fingers, looking for any tenderness, lumps, or masses. Okay. There are no tenderness, lumps, or masses noted. Now I'm going to assess by listening for his breath sounds with auscultation. And you just breathe normally for me. Bronchial sounds were heard, and they were very high pitched, harsh and hollow. Bronchiovesicular sounds were auscultated as well. They're moderate in pitch, and duration was equal and symmetrical. Vesicular sounds were auscultated in a low pitch, soft, and heard over the peripheral long fields. Now I'm going to do vocal resonance, beginning with bronchophony. I'm going to listen with my stethoscope when you say 99 at each point, okay? And they should be soft, muffled, and indistinct. All right. Say 99.
99. 99. 99. 99. 99. 99. 99. 99.
All right. Now, I want you to say E and while I listen, okay? Each spot. This is assessing for egophony.
E. 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 E.
Okay. The E sounds were heard clearly. Pause it. Now I'm going to assess vocal resonance once again, but this time with whisper pectriloquy. So you're just going to whisper 1, 2, 3 while I listen to every spot.
One, two, three. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Excuse me. Excuse me. 1, 2, 3. 1, 2, 3.
Okay. They were faint, muffled, and inaudible.
Action.
Okay, now I'm going to assess posteriorly his breath sounds, beginning with tactile fermentus again, using the side of my hand. Just say 99, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. The vibrations were symmetrical. Now I'm going to percuss posteriorly. I'm just going to feel, and just relax. Alright. There was healthy tissue noted and no lumps or masses or tenderness. Now I'm going to auscultate his posterior breath sounds. Just breathe normally for me, okay? Breath sounds were clear, no signs of wheezing, crackles, or rails, and there was no cough noted. Let's see. Now I'm going to assess vocal resonance posteriorly, beginning with bronchophony. So you're going to repeat 99 while listening to each spot. Okay. Say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Alright. The sounds were soft, muscled, and indistinct. Now, assessing egophony, you're going to say an elongated E the whole time while I listen. The E sounds were heard clearly over all lung fields. And lastly, we're going to do whisper petrology, where you say 1, 2, 3, whisper it at each spot, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. Down to 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. The sounds were faint, muffled, and in this state. Alright, now I'm going to assess your heart. I'm going to begin by just inspecting your chest, looking for any surgical scars. And there are no surgical scars, defibrillator, or pacemaker noted. I'm going to inspect the apical impulse at the 4th or 5th intercostal space, mid-clavicular line. Begin by palpating with my finger. Can you exhale and hold it? Okay, thank you. I'm going to palpate the carotid arteries, one side at a time. Alright, I'm going to assess the pericardium with my palm, and that's going to be at the apex down here. There are no pulsations noted. Okay, now I'm just going to listen to your heart valves, alright? Beginning with the aortic valve, listening for any abnormal sounds or an S1 and S2 sounds. Assessing the mitral valve. Alright, now I'm going to assess its major blood vessels, which includes, we'll begin by inspecting the carotid arteries once again on both sides. There's visible pulsation with no jugular vein distension noted. The pulsations are strong. I'm going to palpate one at a time here. And now I'm going to auscultate one at a time. And there's no bruit heard. Now I'm going to assess for edema. Bilaterally here. There's no edema noted up top. The skin is pink, nice and intact, and very warm. We check the lower extremities. Check this right leg. And there's no edema noted on any of the extremities. Lastly, I'll be assessing his peripheral circulation, beginning with the brachial. Okay. The radial pulses here. The pulses are equal, +2 in strength and non-bounding. I'm going to go to the popliteal. The pulse is equal, +2 on both sides, and non-bounding. We'll do the posterior tibial. The pulses are equal in strength, with quality +2 and non-bounding. And lastly, the dorsal pedis. The pulses are equal in strength, +2 in quality, and non-bounding. And lastly, we will do the Allen test. Just clean my hands here. Do the Allen test, where I depress his nose over here. Can you open and close your fist? Yep, there you go. Keep going. And then there should be good color return once I release, which there is. And that concludes my assessment on my patient here, Johnny.